Today we're going to be discussing just some tools that you can keep in your toolbox to pull out and use for your individualized self-care. I have nothing to disclose. So some of the things that we're going to talk about today that you can use at home independently to help work on yourself, improve your condition, is the use of pumps or pneumatic compression devices, whole body vibration, dry brushing, and we're going to talk a little bit about rebounding if we have time this morning. So pneumatic compression devices, why do they have so many names? They're referred to as pumps, compression devices, pneumatic compression systems, pneumatic compression devices, and APCs as well. It can get a little confusing. There we go. There are many benefits to using a pump in your home program. In terms of patient benefit, it offers more home-based therapy. It offers you more control. You can use it when you have time, fit it into your daily routine. It can result in less visits to see the therapist, which we know could be a cost savings as well. We know that there's documented effectiveness in the literature for the use of pumps in terms of volume reduction. It's convenient. In the long term, it could actually save you money, and it can improve your compliance with your home program if you use it. That's key. In terms of therapist benefit, the pump can help the therapist transfer control over to the patient, help them take ownership in their care. It can be a cost savings to a clinic in terms of being able to work with other patients while one patient is on the pump as well, and allows more flexibility in treatment, especially if a patient lives far away from the clinic and they're not able to come in for regular visits. The pump can be a real adjunct to therapy. There are many different brands on the market. I'm sure you've seen some of them out there in the vendor area as well. We know that there are documented benefits for utilizing a pump in the treatment of lymphedema. There was a study that came out by FlexiTouch that looked at the impact of using their device in terms of clinical outcomes and healthcare cost. There was a group of patients that was trialed. Half of the patients had cancer-related lymphedema, half did not. And the outcome of this study demonstrated that there was a decline in cellulitis, a reduction in the rate of outpatient hospital visits, a reduction in the rate of therapy visits as well, and also a reduction in lymphedema-related costs. But what are the documented benefits for use of the pump with lipedema? There's much less out there in the literature. There was a study that came out in 2008 that looked at the use of a pump with the lipedema population. And this study looked at using the pump along with traditional CDT in one group and not using the pump with traditional CDT in the other group. Both groups received the bandaging, the exercise, and the skincare as well. And in the results, there really was no significant difference amongst the two groups in terms of reduction in lower extremity volume. So this needs to be studied more so in our lipedema population. In terms of keys for pump usage, pumps can be used at any stage of lipedema to promote lymphatic drainage. You want to be sure that the pressure is not set above 40 millimeters of mercury pressure because you want to avoid damage to the lymphatics. And I just want to point out that pumps should be used not as a sole mode of treatment, but in conjunction with a trained therapist as part of your home program. And it does not eliminate the need for wearing compression as well. And if you are investing in a pump, you want to be sure that you're investing in one that has the newer technology not the old. You want to be sure it has multiple chambers, not just the single chambers of the old days. The more chambers, the better. And it's also important to consider purchase of a pump that addresses the abdominal region, because many of us tend to pool at our abdominal region. We carry fluid in our abdominal region as well, so you want to be sure that you're not investing in something that's just going to stop at the top of the leg, because it's going to push all that fluid centrally and then it will pool. You have to have a way of eliminating that as well. It's important that you do obtain a physician prescription for the pump if you want to attempt to have it covered by insurance. Some insurances are better than others. And it's important that you really monitor the effectiveness of the pump. How is it helping you? You can measure this in terms of circumference and function, looking at your pain, visual inspection. In terms of circumference, I think it's important for patients to take measurements. If you keep a little log, so sometimes we forget where we started and how far we've come, and it's nice to look back at those numbers when you're not really sure and really see that reduction objectively. If you're going to be taking your circumferences, you want to be sure that you pick out or select an anatomical landmark that you use consistently, like a freckle on your leg somewhere, or perhaps the knee crease, and then measuring 10 to 20 centimeters above, 10 to 20 centimeters below. You just want to be sure that you're consistent in your measurements. In terms of function, really assess the use of the pump in terms of, are you able to walk easier? Do your legs feel less heavy? Are you having an easier time getting in and out of the car, in and out of bed? Are you able to tolerate standing for longer periods of time or walk further distances? In terms of pain, really paying attention to your pain. Is the pump helping with this at all? You know, has my pain decreased? Do I have less pain for longer periods of time? And really monitoring for changes in tissue. Does the tissue feel less full with the use of the pump? Is it less fibrotic? Does it feel lighter? Moving on to whole body vibration. It's very interesting. Whole body vibration was first used in the Russian cosmonaut program, actually back in the 1960s. And they found that astronauts were able to stay up longer in space with use of vibration because it delayed muscle atrophy and increased bone density, so they were able to stay up in space for longer periods of time. We know that whole body vibration has been shown to offer many health benefits, including weight loss, increases in bone density, blood and lymphatic circulation balance, flexibility, strength, and improved hormonal output in the male population. I've listed here just a few studies that you may want to look up that are helpful in looking at the effects of vibration on balance and ambulation. And I actually had to throw this in because my grandmother had one of these. And I remember she had one exactly like this in her bathroom. And I remember going to visit her and one day just getting real brave and flipping that switch. And as you can see, those things started moving and the strap was going up and down. And oh my gosh, it scared me to death. But I thought it was interesting because my grandma had one. Whole body vibration, we know, has been shown to slow the accumulation of fat in female rats and improve pain and fatigue in women with fibromyalgia. What are the effects on the lymphatic system? Well, we know that whole body vibration improves blood circulation, and this is through the rapid contraction and relaxation of the muscles, which works to help pump those lymphatics. What are the benefits of using whole body vibration as opposed to other forms of exercise? Well, we know that it builds good bone density, which is good for those that may have osteoporosis or osteopenia. We know that it increases serotonin levels as well. It also decreases cortisol, which affects directly our appetite, addictions, and unhealthy cravings, sleep patterns as well, and belly fat holding areas. And it's excellent for neuropathy or related disorders. So why is whole body vibration a good selection for us? There's low impact or no impact, which is good if you have any type of joint problems. Those who struggle with traditional modes of exercise are able to obtain very similar results by using the whole body vibration. And we know that it increases energy metabolism very comparable to that of moderate walking without the stress on the joints. I just wanted to highlight this study that looked at the use of whole body vibration and acquisition of fat in female rats. And what this study looked at was the effects of whole body vibration on fat, bone, leptin, and muscle mass. There were two groups of rats, those poor rats, mice. We put them through a lot, don't we? Half received vibration 5 times a week for 12 weeks. The other did not. And they found significant body composition differences between whole body vibration and the control group, which were quite interesting. The group that received the whole body vibration weighed 10% less. It had less and lower percentage of body fat. Lowered the septin levels. There was greater bone mineral content and bone mineral density in the lower vertebra. And despite all this, there was no increase in food consumption, which I found was really interesting. And looking at serum leptin, the vibrated rats showed lower leptin, and we know that leptin is correlated with body fat and BMI. And we also know that it acts on the peripheral tissue and increases the inflammatory response. So it was interesting to note that the group that received the whole body vibration actually had lower levels of serum leptin, which could apply to us as well in terms of beneficial effects. What are some of the contraindications to whole body vibration? If you have any type of retinal condition, thrombosis, joint implants, pulmonary embolism, retinal conditions, severe diabetes, pacemaker, defibrillator, or epilepsy, tumor or acute hernia. So I'm not sure if any of you have shopped around for whole body vibration. It is so confusing because there are several different types of vibration. There are several different models that are out there. So how on earth do you decide on a product? Well, the two most widely known types of whole body vibration are what's called oscillating and linear. There are 3 types actually there's 4 types, but we're going to talk about 3 types of whole body vibration today. Level 1 is referred to as oscillating. Level 2 is referred to as triplanar or linear. It's the same thing. And level 3 is dual vibration. And I'm going to explain each of those. When we're talking about whole body vibration, we need to be familiar with 2 different terms, which are amplitude and hertz. The amplitude is the range of motion or the amount of lift or drop in the platform's outer edge. So if we're talking about oscillating, how much movement or how much range of motion are we getting with the oscillating movement? If we're talking about linear, more up and down, what is the range of motion? What is the amplitude for that platform? When we talk about speed setting, we talk about hertz. And that's how many times the second platform will travel through the highest point, through the lowest and back. Okay? So in looking at the level 1 type of vibration, this is the most simplistic, and actually this is probably the most popular. It resembles a teeter-totter motion, close to walking. This type is very good for lymph drainage and weight loss. It has a higher amplitude, so that range of motion is a little bit greater, although it's very small. But comparatively speaking, it has a higher amplitude, less than an inch, but a lower speed, 1 to 20 hertz. There's minimal G-force with this type of whole body vibration, which is good if you have any type of joint problems as well. Moving on to the level 2 or triplanar linear. This type of platform can move up and down or back and forth in one continual motion. The amplitude or range of motion is less in this type of vibration, but the speed is faster. The speed is 20 to 50 hertz as opposed to 1 to 20 in the level 1. And this is really geared more towards strength building and bone density versus burning fat. This unit also has higher G-forces, so that's something to take into account if you have any type of joint problem or joint damage as well. Those sudden change of movement can kind of be jarring and put a lot of pressure on your knees. We also know that the level 2 tends to be a little bit more expensive. It's used mostly with professional sports teams, athletes, and at rehab facilities as well. The dual motion is the newest type of whole body vibration that's out there, and it's pretty neat because it combines 1 and 2 into one unit. So if you want to work on your lymphatic circulation, if you want to work on losing weight, but you also want to work on strength training, this would be probably the unit for you. The platform moves in 3 different planes at the same time, but you can also separate the different movements out, which is pretty neat. You can use the oscillation for the weight loss portion or lymphatic drainage, or use the spiral rotational mode, which is at a higher speed and a lower amplitude to build strength. So which one is best for lymphatic drainage? If you're really concerned on using this product to increase your lymphatic circulation, probably the best choice for you would be a level 1, which has the lower speed and the higher amplitude to work on lymph drainage and weight loss. Like I mentioned before, the higher speed with the lower amplitude or range of motion helps with issues such as osteoporosis and strengthening. So I put together this chart. I took some information from this website that I have listed here, and I kind of altered it because I didn't agree with everything that they had written. So if you look at the left-hand column, it lists out what you might be wanting to achieve. And then if you look at the 3 different types of vibration, I've ranked them as minimal, excellent, good, just depending on what your goals are for use of the product. Moving on to dry brushing, I'm not going to spend a whole lot of time on this because you can go to the FDRS website and there are videos on how to dry brush. But we know that there are benefits to dry brushing. It's one more tool in your toolbox. We know that it increases surface circulation, stimulates the lymphatic system, it stimulates the immune system. Obviously, it's very cost effective and easy to do. How do you dry brush? You want to be sure that you're dry brushing when your skin is dry and not wet. Using a long-handled brush with natural bristles versus artificial, because the artificial can scratch and irritate your skin. And you're wanting to use long strokes, working distal to proximal. And you want to use just enough pressure to stimulate, not irritate. You're not pushing very hard because that's just going to irritate your skin. Very light, very long strokes, very soft. And like I said, there's a full video starring Yvonne on the Fat Disordered website. I helped a little bit. So talking about dry brushing, I just threw up a slide here of that lymphatic map following the pattern of lymphatic flow within the lymphatomes. And real briefly, I've had a lot of people ask about rebounding, so I thought I would throw this in as well. Don't ever try to jump that high. It's very, very dangerous. There's a much easier way to go about this. So how to rebound for lymphatic drainage? You don't even have to jump off of the mat itself. You want to be sure that you're standing with your feet shoulder width apart, and you can begin by just very gently lifting your heels off the mat to get a good bounce going, slightly. With each bounce, you're going to press your heel back into the mat. Like I mentioned, your feet don't have to even leave the surface. You want to be sure you're keeping your knees bent to protect your back, protect your joints. And the more bounces per minute, the more lymph fluid is moved. How does this happen? Through changes in tissue pressure. At the bottom of the bounce, the G-force is highest. At the top of the bounce, it's lowest. And it results in a compression and decompression of the musculature, affecting the lymphatics and flow. Another way to use rebounding is by holding weights while you're on the rebounder. You could consider using dry brushing just before you get on the rebounder to improve lymphatic circulation even more. Some of the rebounders come with handles that you can hang on to so you don't lose your balance. And if you have difficulty with this, you could even sit on the rebounder and have somebody bounce it for you. And that's it. Thank you.